In this video, we will provide information to staff members on the basics of overseeing students in the isolation room. The isolation room is simply a room to allow students with symptoms of illness to rest. These symptoms may or may not be COVID-related. Students will be screened by the health staff for the symptoms listed. If the health staff deems it necessary for the student to go home, they will contact the parent or guardian for student pickup. Exhibiting the symptoms listed does not mean the student has COVID-19. Sending the student home is a precautionary measure to protect staff and other students from potential exposure of the student's symptoms. The role of the supervisor is to monitor students to ensure their safety until the parent or guardian picks them up. Staff members monitoring the room should remain 6 feet away from students and wear a mask. If there is any immediate medical concern regarding the student's health, radio the health staff. Each school site will designate the location of the isolation room. Check with your health staff or administration to determine the location. Students should remain at least 6 feet apart while in the isolation room. Supervision may occur through a door or window as long as the student can be seen and heard should they require attention. If there are too many students to fit into the isolation room where 6 feet cannot be maintained, it may be acceptable to allow students to be monitored in the outdoors, weather permitting. Each site will determine the process for parents and guardians picking the student up. A recommended process is laid out in the Hemet Unified School District COVID Guide. Check with your health staff or administration to determine the process your school will be following. Once the student has been picked up, be sure to radio the health tech who will inform the parent of quarantine and isolation requirements. Work with your health staff to determine who will radio or notify the custodial staff to ensure the isolation room is properly disinfected. Supplies will be available in the isolation room, which include personal protective equipment, a HEPA filter, trash cans, and hand hygiene products. A radio should also be made available to the staff member supervising the room. Personal protective equipment, or PPE, is available to staff members overseeing the isolation room. The purpose of PPE is to protect the user from exposure to hazardous materials. The type of PPE selected depends on the type of anticipated exposure. PPE provided will include gloves, gowns, masks, and face shields. Supervisors overseeing the isolation room may don or put on the appropriate PPE if desired while monitoring the student or if coming into close contact with them.
Putting on PPE is called donning, and taking off PPE is called doffing. Donning and doffing demonstrations will begin in this section of the video.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room. How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
If you have any questions regarding the information provided in this video, please reach out to your district school nurse.